Ponesimod, Ponvory, is an oral DMT approved to treat adults with relapsing forms of multiple sclerosis to include clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease. It adds to other sphingosine 1-phosphate receptor, S1PR, modulator inhibitors, fingolimod, siponimod, and ozanimod. Consider cardiology evaluation if cardiac disease is present or on medications that slow heart rate. All patients should be monitored for development of infection, cutaneous malignancies, and cardiac changes. While most patients do not require monitoring during the uptitration, first dose blood pressure and heart rate monitoring is still recommended for some with bradycardia with 55 beats per minute, first or second degree, Mobitz type I, AV block, or a history of myocardial infarction or heart failure occurring more than 6 months before initiating treatment and in stable condition. Its half-life of 33 hours, if 4 or more missed consecutively, requires a new titration starting at day 1. Contraception should be used for at least 1 week after stopping Ponesimod to avoid fetal harm. Ponesimod is contraindicated for patients who in the past 6 months have experienced myocardial infarction, unstable angina, stroke, transient ischemic attack, decompensated HF requiring hospitalization, or class 3/4 heart failure. Avoid using with rifampin, phenytoin, carbamazepine. Concurrent administration is not recommended. Titration package is supplied to start 2 mg. About 14-day titration. No renal or hepatic dose adjustment is needed. Prevents egress of lymphocytes from lymph nodes, going into the CNS. Further reading is required. Ponesimod. Ponvory.